Hello, very good morning to all of you. Today we are going to see the case note of Mr. Freddie Mercury, and who has the diagnosis of recurrent herpes simplex virus infection. So he has been under your observation at the infection control unit at Greeley Infection Control and Care Hospital, and you are a nurse working in this particular setup. Now let us go ahead with the writing task. The writing task goes like this. Using the information given in the case notes, write a discharge letter to Dr. Alex Smith, the patient's family physician, informing him about the patient condition and the care that needs to be done at home. So what you are writing is a discharge letter, and you are writing this discharge letter to the family physician of Mr. Freddie. Mr. Freddie, yeah, Freddie Mercury, Mr. Mercury. So the family physician of Mr. Mercury. So you need to understand that as Dr. Alex Smith is the family physician of Mr. Mercury, he knows the social background, the past medical history, all the address, all these things. He knows what things happened to him, what medical conditions were, what is his social background, everything he knows, because he's his family physician. He needs to know about the current condition of the patient. Because he was admitted yesterday, he was admitted to your care yesterday, and the patient is getting discharged back today. So the most recent history is unknown to the family's physician. So this is what you need to update to Dr. Smith. And you have to give him the information of regarding the most recent condition of Mr. Mercury and the care Mercury needs at home. So this is what our letter is. And what we have further, we have to see. We have the full name needed, age needed. We don't need the other status, married, male. We don't need these things. We need Freddie Mercury, the age, the diagnosis. All these things we don't know, we don't need, because the patient's family doctor, Mr. Smith, knows all these things. Family history, no, we don't need. Past medical history, no, we don't need. Past surgical history, it is not just past surgical history. It includes two more things. I have missed it somewhere. So when I copied and pasted, it went out. So anyway, all these data is irrelevant here in this letter. Only two things we need in this page: the three things: the name, age, and the diagnosis. And one more thing I just want to, yes, this is needed. You are working in this particular hospital, you are a registered nurse. This is also relevant information which we need. Okay, 1, 2, 3, 4, 5. No other information is relevant. Now, when we go with the medications, this is regular medications, and this too is not needed because the family's physician the physician knows he's taking Ventolin, Serotype inhaler, Ipratropium, all these things he knows. Now we have the recent nursing notes. From here, it becomes relevant. So here we have 8th to 16th. The 16th is the discharge date. So here, if you look closer, this particular data, on 8th June, he was first presented to the clinic. He was advised for a follow-up after 2 weeks, but he did not do that. So you can read out that 8th June, he presented to us plus 14 days, that is 2 weeks. That's around 22nd of June, he was supposed to present to the infection control clinic, but he didn't do that. So he reappeared to the clinic only on 15th. This is what. So you have almost a month, more than a month gap between his first and second visit. So the most recent visit is this thing, and this is not a recent visit. And we don't have serious problems there. Arrived, reddish eye, severe itching, watery eyes, temperature for these things. So he took anti-allergic drugs, unclean use of counseled infection. So he was counseled, medicine was prescribed, and he was advised to review. So we need to brief it. Actually, we don't need to expand it. We will be briefing it, but we need to explain the rest of the data. That is what happened on 15th and what happened on 16th is what should be our focus. It's not the remote present history. That's 8th June is also the treatment which you have given, but it was almost 1.5 months ago it happened. So the most recent history is yesterday and today, and this is what we have to focus. We have a lot of information there. We have almost all the information important and relevant there because this is a non-case. So what the GP, what the family's physician is not aware of is what happened today and what happened yesterday. So this is what we are going to present in the letter. So this is 16, that is today's date, the discharge date, Dr. Alex Smith, family physician, RB Community Health Center, River. So we need to address Dr. Dear Dr. Smith. Okay, so that's it. You have addressed, and the reference is also given. The reference is, okay, for Mr. Freddie Mercury, aged 43. Now, this is the purpose. What we have written here is, I'm writing to update the most recent health status of Mr. Freddie Mercury, who has been diagnosed with recurrent herpes simplex viral infection. So his diagnosis is given. So you have told that I'm going to update the most recent health status of this patient. Now what he requires is that he requires a detailed education. I request you to give a detailed education. Okay, along with follow-up care at his home. Okay, request, I can say further education instead. further education regarding, because you have given education at your care infection control unit. So further education requires regarding his condition, along with the follow-up care at his home. He needs follow-up care also from you, because he is discharged back his home today. Now, this is the first particular paragraph. What we can see here is Mr. Mercury, who failed to appear for the follow-up after 2 weeks since his first appointment at our care, represented yesterday with worsening symptoms of viral infection. So we have said that the previous appointment, that was on 8th June, he presented once. It is said, it is included, it is briefed here. Now, with this word worsening symptoms, we understood that he had similar symptoms of viral infection earlier when he presented almost a month ago. So it gives a lot of information. It gives information that Mr. Mercury had appeared to you yesterday, and it was a representation. It was his second visit. His first visit was there, and there was a follow-up care after 2 weeks after his first appointment. But he failed to represent on time. So it's understood that worsening symptoms of viral infection, in the sense he had viral infection symptoms before when he presented. So when we compare the first visit and the second visit, now this severity is more in the second visit. The first visit, he had viral infection. It was not that much severe. That's what we can understand from this particular sentence. So we need to brief. We cannot explain everything what happened a month ago. So we are going ahead with the recent history, what is happening at present. We are updating what's happening at present. He complained of severe headache and his face was swollen on both sides. And this is what we have seen during the assessment when he came yesterday. Subsequent examinations confirmed that he has severe herpes infection, and therefore he was kept under close observation for the next 24 hours. So we did examination further and did find out that he has herpes simplex. Its grade is high and severe. The condition is severe. And now he was kept under close observation for the next 24 hours. So this is what we have done since his representation yesterday. Now, what you have given him, so what treatment you have given him? At our care, Mr. Mercury's antiviral drug, acyclovir's dosage was increased from 400 milligram to 1 gram since he was non-compliant with it during his last episode of infection. So you have given a further data regarding his last visit too. Again, in the second paragraph too, we mentioned during his last episode of infection, that was from 8th of June, he was not compliant with his antiviral medication, that was acyclovir 400 mg, because it was not compliant. He was not compliant. This dosage was increased by 600 mg, and now right now it is 1 gram acyclovir, and we started it today. The same has to be continued for another 4 days. So today, that's the date, 15th, I think so. Yeah, 15th we 15th we started. So it has to be continued for another 4 days. So 1 day is over. We increased the dosage to 1 gram. 1 day has gone. Today is the date of discharge. Today, tomorrow, day after tomorrow, and the day after. So 4 more days we have to give. So as per the discharge plan, you can see that it has to be given for 5 days. So we started the medication on 15th. You can see it started on 15th. So 1 day is over. Today's date is 16th. So we cannot write 5 days. You can write, so 1 day is over means 4 more days are there. So that's what we have written there, which the same has to be continued for another 4 days. He's also prescribed with paracetamol 1 gram, omeprazole 40 milligram, hydrocortisone cream, and sterile tear drops to relieve his symptoms. In order to relieve his symptoms, we have he has been prescribed with this thing, this thing, this thing, this thing. Okay, so we have said almost every minute data here, and we have included one more thing. So we have said that he had a non-compliance with acyclovir. His dosage was increased to 1 gram, and it has to be continued for 5 days. All these things are included in this particular paragraph. Now that's another thing we need to observe. Another thing, so the last paragraph. So it would be appreciated paragraph. Upon his discharge, today we have not said when is the discharge in the purpose paragraph, because it would become a little bit lengthy there. So we have said, upon his discharge today, kindly help Mr. Mercury to maintain strict medication compliance and educate him and his family regarding preventing the recurrence of infection, including proper hand hygiene. So you have said that we have ordered, so that encourage strict medication compliance, provide a teaching about herpes infection, involve family, like proper hand hygiene. So these 3 data we have included in the first sentence. Now, it is also recommended to isolate him till his complete recovery and monitor his family for any signs of infection. You have said encourage isolation till his complete recovery and assess his family for any signs of infection. So we have completed 1, 2, 3, 4, 5. Now we have 2 more things. We have to say that too. Kindly discourage Mr. Mercury the use of unclean bike helmets. So that's the next thing that we have done. Yes. The medication acyclovir was said already in the previous paragraph, so we don't need to go ahead with that. So we have completed the request too. So let's go with the request once again. Upon his discharge today, help Mr. Mercury to maintain strict medication compliance and educate him and his family regarding preventing the recurrence of infections, including this thing. Isolation, and monitor the family for any signs of infection. Discourage the use of unclean bike helmets. So should you require any further queries regarding Mr. Mercury, please do not hesitate to contact me. Yours sincerely, your infection control registered nurse, Greenlee Infection Control and Care Hospital. So that is the explanation. That is the end of the explanation. So we have, you can see the letter as a whole. So we have briefed it. We have briefed briefed what happened on 8th of June, and we have given in detail what happened yesterday and what treatment we have given yesterday, and we have set the requirement too. This is all about the letter of Mr. Freddie Mercury. This is a non-case, remember. So that's why we have skipped the many a lot of information there. Thank you.